Hi everyone, and welcome to today's discussion regarding coronary artery disease. Today we are going to be talking about the detrimental effects that this disease may have on an individual. The discussion will begin by talking about coronary circulation and its importance, in which we will then discuss what coronary artery disease is, what causes it to develop, and how this disease can have damaging effects on people. We will then conclude our discussion by looking at research regarding advancements, treatments, and prevention. Now that we have gone over what we will be discussing, let's begin. The heart is a muscle, and its job is to pump blood throughout your circulatory system. Your heart is at the center of the circulatory system, which is a network of blood vessels that delivers blood to every part of your body. Blood carries oxygen and other important nutrients that all body organs need to stay healthy and to work properly. The heart is unable to collect the oxygen that it needs for continuation of contraction from the blood within its chambers. There are two reasons for this. The first reason is because the blood is not permitted to pass from the chamber to the myocardium due to the endothelial lining. The second reason is due to the muscular lining of the heart being too thick for the diffusion of oxygen as well as other important nutrients. Because of this, the heart relies on blood vessels, which are located near its exterior, for this oxygen and nutrient harvesting. Coronary arteries supply blood to the heart muscle. Like all other tissues in the body, the heart muscle needs oxygen-rich blood to function. Also, oxygen-depleted blood must be carried away. The coronary arteries wrap around the outside of the heart. Small branches divide into the heart muscle to bring it blood. The two main coronary arteries are the left main and the right coronary arteries. The left coronary artery supplies blood to the left side of the heart, the left ventricle, and left atrium. The left main coronary divides into two branches. The first branch is the left anterior descending arteries, which branch off the left coronary and supplies blood to the front and back or left side of the heart. The circumflex artery branches off the left coronary and encircles the heart muscle. This artery supplies blood to the outer side and back of the heart. The right coronary artery supplies blood to the right ventricle, the right atrium, and the sinoatrial and atrioventricular nodes, which regulate the heart rhythm. The right coronary artery divides into smaller branches, including the right posterior descending artery and the acute marginal artery. Together with the left anterior descending artery, the right coronary artery helps supply blood to the middle of the septum of the heart. Now that we have discussed coronary circulation and how it is important for the heart to function properly, let's now look at coronary artery disease. Coronary artery disease develops when the major blood vessels that supply your heart become damaged or diseased. Cholesterol-containing deposits, such as plaques, in your coronary arteries can cause inflammation and are usually to blame for coronary artery disease. The coronary arteries supply blood, oxygen, and nutrients to your heart. A buildup of plaque can narrow these arteries, decreasing blood flow to your heart. Eventually, the reduced blood flow may cause chest pain, shortness of breath, or other coronary artery disease signs and symptoms. A complete blockage can cause a heart attack. Because coronary artery disease often develops over decades, you may not notice a problem until you have a significant blockage. Because coronary arteries deliver blood to your heart muscle, any disorder or disease that affects these arteries can have serious implications by reducing the flow of oxygen and nutrients to the heart muscle. Coronary artery disease is the most common type of heart disease and is the leading cause for death in both men and women, resulting from three possible factors. The first factor is vascular spasms. The second is atherosclerotic plaques, and the third is thromboembolisms. We will first begin by discussing vascular spasms, which are typically associated with early stages of coronary artery disease. Vascular spasms are characterized by the narrowing of the arteries caused by a persistent contraction of blood vessels. Tightening reduces the amount of blood that can move through the vessel, sometimes even closing it completely and blocking blood from moving through, which is known as vasoconstriction. Vascular spasms can affect any area of the body, including the brain and the coronary arteries. A coronary artery spasm is a temporary tightening or constriction of the muscles in the wall of one of the arteries that sends blood to your heart. If a spasm lasts long enough, you can have chest pain or even a heart attack. Unlike typical angina, which usually occurs with physical activity, coronary artery spasms often occur at rest, typically between midnight and early morning. Coronary artery spasms in the vessels around the heart are more common in people with risk factors of heart disease like high blood pressure or high cholesterol. Though they can happen to anyone, smokers are also at higher risk of developing vascular spasms. Vascular spasms may occur at any time and aren't necessarily triggered by physical exertion. They can happen to a person who is at rest. Finally, they may be caused by plaque accumulation in the vessels around the heart. Possible triggers that can cause coronary artery spasms may include tobacco use, exposure to cold, extreme emotional stress, or the use of illegal stimulant drugs such as amphetamines and cocaine. Treatment of vasospasms depend on the severity of the condition and the area of the body that it is affecting. For more severe cases affecting coronary arteries, treatment will focus on minimizing chest pain and preventing a heart attack. Both of these goals can be achieved through medications such as nitroglycerin, long-acting nitrates, calcium channel blockers, or beta blockers. Next on our list is atherosclerotic plaques, which can be characterized by buildup of plaque and fatty deposits in your arteries. These deposits are made up of cholesterol, fatty substances, cellular waste products, calcium, and fibrin, which is a clotting material in the blood. As plaque builds up, the wall of the blood vessel thickens. This narrows the channel within the artery, which reduces blood flow. The reduction in blood flow affects the amount of oxygen and other nutrients reaching throughout the body. Where plaque develops and the type of artery affected varies with each person. Plaque may be partially or totally blocking blood flow through large or medium-sized arteries in the heart, brain, pelvis, legs, arms, or kidneys. This can lead to conditions such as coronary heart disease, which is when there is plaque in the arteries leading to the heart, angina, which is chest pain from reduced blood flow to the heart muscle, carotid artery disease, which is plaque in the neck arteries supplying blood to the brain, peripheral artery disease, which is when plaque is in the arteries of the extremities, especially the legs, and chronic kidney disease. If the blocked artery supplies the heart or brain, a heart attack or stroke occurs. If an artery supplying oxygen to the extremities, often the legs, is blocked, gangrene or tissue death can be a result. Atherosclerosis is a slow, lifelong progression of changes in the blood vessels that may start in childhood and get worse faster as you age. You might not have symptoms until your artery is nearly closed or until you have a heart attack or stroke. Possible causes can be elevated levels of cholesterol and triglycerides in the blood, high blood pressure, cigarette smoking, and diabetes. Symptoms related to coronary arteries include arrhythmia, an unusual heartbeat, pain or pressure in your upper body, including your chest, arms, neck, or jaw, and shortness of breath. Atherosclerosis makes blood clots more likely to block the arteries and the veins. There is a point where atherosclerotic plaques may rupture. If this occurs, it can contribute to the formation of clots, known as a thrombus. This clot can block or obstruct blood flow in the affected area. In some cases, the blood clot may break free and travel around the body, which is a process known as embolization. This can obstruct the blood flow to essential organs, such as the brain or the lungs. Thrombosis can be broadly classified as either venous thrombosis or an arterial thrombosis, according to where the thrombus presents in the body. When a thrombus forms in an artery, such as in the heart or brain, it is called an arterial thrombosis. When it occurs in a vein, it is called a venous thrombosis. When this happens in the deep veins of the leg, it is called a deep vein thrombosis. However, a clot can form more easily when a person uses tobacco, has high cholesterol, is obese, has cancer, diabetes, has high stress, or has an inactive lifestyle. A thrombus in the artery can result in unstable angina, which is a type of chest pain, heart attack, ischemia stroke, peripheral artery limb ischemia, which is a condition that significantly reduces blood flow to the limbs. A thrombus in the vein, usually a deep vein in the leg, may lead to the following symptoms: pains, swelling, and tenderness, usually in the calf, aching and the warmth of the skin in the affected area, red skin, which can be particularly at the back of the leg below the knee. People who experience any of these symptoms should seek urgent medical attention. These conditions all require prompt medical assistance. The aim of treating a thrombus is to achieve the following quickly and effectively: gain control over the symptoms and restore blood flow and reduce and remove the thrombus. Risk factors that can often be associated with coronary artery disease may include age and gender, ethnicity, family history, smoking, high cholesterol, high blood pressure, physical inactivity, and being overweight or obese. Even though coronary artery disease is one of the most common causes of death worldwide, in the last decade, significant advancements in coronary artery disease treatment have been made. The existing treatment has been mainly medical and surgical based, or a combination of both, depending on the presentation of the disease. The collaboration between different science disciplines, such as biotechnology and tissue engineering, has led to the development of novel therapeutic strategies such as stem cells, nanotechnology, robotic surgery, and other advancements, including 3D printing and drugs. Stem cells have shown research in cardiovascular disease has sought to repair myocardial damage and increase blood supply in ischemic conditions of the heart, thereby reversing the effects of coronary artery disease. In this respect, both vascular growth factors and stem cells have generated a lot of interest as a mode of treatment with these types of patients. Research in the cardiovascular disease has thought to repair myocardial damage and increase blood supply in ischemic conditions of the heart, thereby reversing the effects of coronary artery disease. In this respect, both vascular growth factors and stem cells have generated a lot of interest as a mode of treatment in patients with coronary artery disease. While stem cell therapy continues to be a promising treatment modality for coronary artery disease, the experimental and clinical studies have been showing promising results. However, further research is needed to understand the exact mechanisms of action and the ideal source of stem cells to derive optimum benefit and further our understanding. Several challenges have to be overcome, such as long-term and safety routine and administration, but the direction of the current research looks promising. Nanotechnology has led to an interesting and promising direction in the treatment of coronary artery disease. It has valuable potential in delivering drugs. Its applicants in stent and gene therapy are potentially useful for future therapeutics based on these modalities. Further randomized controlled trials need to be conducted to establish strong evidence to support the use of these newer technologies for coronary artery disease treatments. This needs to be carried out with strong collaboration between researchers, engineers, biomedical engineers, nanotechnologists, and clinicians. As the technology and evidence develops, we will soon enter an era where existing established treatment modalities could be questioned and eventually replaced by nanotherapeutics. Robotics are also being used for catheter-based surgical procedures. Robotics have also been used to perform coronary artery bypass grafting with patients who have coronary artery disease. Robotically assisted hybrid coronary revascularization, which involves coronary artery bypass graft, as well as percutaneous coronary intervention, has also been developed as a treatment modality for coronary artery disease. There have been reported benefits such as reduced morbidity and shortened hospital stays due to the minimally invasive nature of the procedure. Although there are reported benefits for using robotics for treating patients with coronary artery disease, high costs and long learning curves have slowed down its progression towards becoming used more routinely. Despite great progress in cardiovascular research, coronary artery disease remains one of the most common causes of morbidity and mortality worldwide. However, significant intercollaborative efforts between researchers, clinicians, and other related professionals have led to multifaceted and novel strategies to be developed to treat coronary artery disease and its associated conditions. Though some of these strategies have strong evidence supporting their clinical use, some others are still in the experimental stage. Despite only early evidence being available on some of these novel treatments modalities, the results are promising and hold potential to become alternatives to current treatment options in the future.